Here is a public service announcement brought to you by SWASU's Department of Nursing. I am here to bring you information regarding disorders of the female reproductive tract. This includes cervical, endometrial, and ovarian cancers. First, let's go over what the female reproductive tract consists of. This is a side view of the female reproductive tract.
First, this is the vaginal canal. This is the cervix, the uterus, and then the ovary. And then here is a better view of the ovary.
So now that we know the anatomy of the reproductive tract, let's get into some terminology that's important to know. A pap smear is a small brush or spatula that's used to gently remove cells from the cervix. HPV, that's the human papillomavirus infection. STD, and that's sexually transmitted disease. STI is a sexually transmitted infection.
Here are some tools to know when you go for your annual pap smear. This is a speculum. They can be made out of plastic, metal, or other materials. It is used to open the vagina so that the provider is able to see the view that they need to see. After this has been inserted, another tool that is used and is in a sterile package is a cervical swab. This is just a simple little swab that will be used to collect cells and then sent off in a tube.
So we're going to demonstrate how to do a pap smear. First, you grab the speculum and then you'll put lubricant around the edge and it'll be inserted into the vaginal opening to open up viewing.
Keep in mind that this is not a flexible model, so the speculum will not actually be inserted into the vagina during this demonstration.
So you'll take this and then you'll insert it through here and then scrape the side to get cells from the cervix.
That was great.
Now we're going to dive into female reproductive cancers. Cancer that starts within the opening of the cervix is called cervical cancer, which Amber is going to demonstrate where this is at.
The cervix is at the lowest part of the uterus, right there.
This is the only gynecological cancer that can be prevented. Certain types of HPV can cause cervical cancers. Ways to lower the chances of getting cervical cancer include getting the HPV vaccine, protecting yourself from HPV by wearing condoms during sex, and getting regular pap smears. Some signs and symptoms of cervical cancer include many that don't have any signs and symptoms at all, irregular bleeding or pain, constant pelvis or back pain, bleeding after pelvic examination or intercourse, and increase in vaginal discharge.
When one is going through treatment or going for their regular appointment, a nurse is going to be very involved in care. The nurse is going to intervene in ways of education, as well as assist with procedures that the provider may be completing. Something that the nurse will be looking for, or another word is assessing, is vaginal discharge, if there is any, what it looks like, color, consistency, things like that. They'll be looking especially for any bloody discharge, any foul smells, and any unusual colors. Question patients about their risk factors, such as any family history, any smoking history, sexual history, and a long-term birth control use. The nurse will be assessing the patients for a number of things. They will also be asking quite a few questions. The nurse will be assessing for symptoms such as pelvic pain, bleeding between periods, abdomen or back pain, bloating, and bleeding after menopause.
All of the things discussed thus far can have an impact on your reproductive health. In all three cancers, there is a possibility of a need for a hysterectomy. A hysterectomy is a surgical procedure to remove the womb or uterus. You'll no longer be able to get pregnant after this operation. If you have not already gone through menopause, you'll no longer have periods regardless of your age. Radiation and chemotherapy can also cause risks for infertility. Radiation treatments use high-energy rays to kill cancer cells. Radiation that's aimed at or around a woman's reproductive organs can affect fertility. Fertility depends on the female's stage in life, menstrual history, hormone levels, the type of cancer and the treatment doses. Because all these factors need to be considered, it can be hard to predict if a woman is likely to be fertile after chemo. Something to note is that with different types of treatments, hormone replacement therapy may be needed, but that will be a decision made by your provider.
Some further information regarding the ovarian cancers. Ovarian cancer is a growth of cells that form in the ovaries. The cells multiply quickly and can invade and destroy healthy body tissue. Ovarian cancer treatment usually involves surgery and chemotherapy. Epithelial ovarian cancer is a type that's the most common. It includes several subtypes, including serous carcinoma and mucinous carcinoma. Stromal tumors are rare tumors that are usually diagnosed at an early age and stage than any other ovarian cancers. And germ cell tumors are rare ovarian cancers which tend to occur at a younger age.
So here's some further information regarding cervical cancer. Cervical cancer is a type of cancer that occurs in the cells of the cervix, which is the lower part of the uterus that connects to the vagina. Various strains of the human papillomavirus, HPV, which is a sexually transmitted infection, play a role in causing most cervical cancer. Squamous cell carcinoma is a type of cervical cancer that begins in the thin, flat cells lining the outer part of the cervix, which projects into the vagina. Most cervical cancers are squamous cell carcinomas. Adenocarcinoma is a type of cervical cancer that begins in the column-shaped glandular cells that line the cervical canal.
Some further information of endometrial cancer. Endometrial cancer is a type of cancer that begins inside the uterus. The uterus is the hollow, pear-shaped pelvic organ where fetal development occurs. Endometrial cancer begins in the layer of cells that form the lining, the endometrium, of the uterus. Endometrial cancer is sometimes called uterine cancer. Endometrial cancer is often detected at an early stage because it frequently produces abnormal vaginal bleeding. If endometrial cancer is discovered early, removing the uterus surgically often cures endometrial cancer.
Here's some more information about HPV, also known as human papillomavirus. As it states, this is a virus, and like we talked about earlier, this is sexually transmitted. There is no cure for HPV itself. There are treatments available that healthcare providers can prescribe and perform that can help treat the HPV symptoms, such as warts, any of the cervical changes that may be occurring, as well as the cervical cancer itself, like we talked about earlier. As mentioned, there are very many different strains of HPV that are out there. This is typically spread through vaginal or anal intercourse, also known as sex. This also can be spread from mother to baby during pregnancy. So this is something that needs to be brought up to the obstetrician. As previously mentioned, there are symptoms that can arise with HPV infection, but in some case scenarios, there are no visible symptoms such as the warts or anything like that, and they can actually go undetected for a number of years. This also can still be spread through intercourse during this time. It's a good rule of thumb to go ahead and see your gynecologist or your specialist regularly. That can look like once a year, twice a year, whatever you and your physician decide is best for you. If you or your loved one is suffering from any of the diseases or the cancers that we spoke about today, please reach out to your primary care provider if you do not have a specialist available. Go ahead and get seen today. We gathered our information from our public service announcement from many different sources today. Here are some of those. The CDC, the Mayo Foundation of Medical Education and Research, the NCI Dictionary of Cancer Terms, which also stands for the National Cancer Institute. These all were accessed on October 19th, 2021, making this relevant and recent research. Don't forget, your friendly public service announcement was brought to you by SWASU Department of Nursing. Bum, bum, bum!